You ready to go? Imagine sleeping peacefully, then being awakened by excruciating pain that lasts for hours. Or walking in the park with your family and suddenly pain starts and you have to stop immediately what you're doing to sit down. Or missing days from work, school, or activities due to pain. Well, that's the typical life of women living with endometriosis. According to endometriosis.org, 176 million women worldwide suffer from endometriosis. And here in the United States, we spend over $22 million annually. Now, most women are misdiagnosed and continue to have pain, and they don't know what's going on. So today, I'm here to bring awareness of what endometriosis is, the symptoms, how it affects the body, and treatment, so women know what they're looking for. Like most people, I know you're sitting there thinking, what in the world is that? I felt the same way when I was diagnosed at the age of 17 with the disease. Endometriosis was discovered in 1860 by Baron Carl Bond. And it is when the tissue that normally lines the inside of the uterus grows on the outside of the uterus and implants on the ovaries, bladder, fallopian tubes, and bowel. During each menstrual cycle, the tissue builds up, breaks down, and sheds. But with endometriosis, it has no way of leaving the body, which causes inflammation and internal bleeding. And that causes pain, scar tissue, inflammation, adhesions, bowel problems, and infertility, which is the biggest complication with endometriosis. Most cases of endometriosis is diagnosed in women around 24 to 35 years of age. But they have found it in girls as young as 11 years old to women past menopause. And all the studies performed show that there is an unknown cause of endometriosis. But according to the Endometriosis Association, certain risk factors such as food allergies, eczema, obesity, family history of endometriosis, exposure to toxins, or being a white or Asian woman put you at a high risk of developing. Now, there are four stages of endometriosis: minimal, mild, moderate, and severe. The level of a woman's stage doesn't determine her pain level. For an example, a woman can have very painful symptoms but only have stage 1. Or a woman can barely have any pain and have stage 4 endometriosis. It all depends on the woman. Now, the most common symptom is pelvic pain, which most doctors misdiagnose with pelvic inflammatory disease, also known as PID. Other symptoms include pain before or during menstrual cycles, pain during intercourse, painful urination during cycles, diarrhea, constipation, nausea, and infertility. The reason for infertility is because the adhesions that may occur trap the egg near the ovaries, making it difficult for the egg to travel down the fallopian tube to get fertilized by the sperm. Now, studies at Mayo Clinic show that 30 to 40% of women with endometriosis are infertile, and the longer a woman waits to have a child, the worse endometriosis gets. Now, there are four different tests performed to diagnose endometriosis. The most common is a laparoscopy, which is a minor surgical procedure done under anesthesia. And that's where they put a thin scope into the abdomen to view the pelvic area. This test is able to show the location, the size, and extent of the growth. Also, during this test, the doctor can remove it based on his or her discretion. The other three tests are ultrasound, colonoscopy, or blood test. If diagnosed, there will be treatment options available, such as birth control, which is the most common treatment because it helps the long-term suppression of endometriosis. Next is hormone medications such as danazol or progesterone, which also suppresses the growth of endometriosis, but it is not long-term. Pain medicines such as morphine or anti-inflammatory medications, natural therapies such as herbal medicines, massages, yoga, and Chinese medicine. Now, there are three surgery options: laparotomy, which is a major surgery that cuts or burns tissue or cysts when endometriosis is severe. bowel surgery that is performed when scarring develops on the bowel. Last will be a hysterectomy, which is the removal of the uterus and is usually performed on women after their childbearing years or if endometriosis is so severe that and a woman agrees that she doesn't want children. So in conclusion, we have learned what endometriosis is, how it affects the body, and the treatment options. So if you or anyone you know is experiencing any symptoms, it is important to get help. I recommend that you see your gynecologist as they specialize in it. But if you don't have one, go to your local doctor and they will help you find one. Thank you for your time today.